So perhaps your patient is thinking about returning to sport following their ACL reconstruction, but you as the physio want to make sure you've got the right evidence to be sure that they're physically and psychologically ready for that return. If that's what you're looking for, you've come to the right place. Keep watching. Hey everyone, Khalid here. Welcome back to Clinical Physio. So perhaps your patient who's had their ACL reconstruction is now 9 months post-surgery and they feel ready to return to sport. They've been doing really well with their rehab, they're doing fantastically on all their strength tests, but you want to make sure that they're ready for action. In this video, I'm going to detail some key tests that you can use to be sure of that. Now, I also want to give huge credit to Randall and Mick Hughes, who have developed the Melbourne ACL 2.0 Rehab Guide, which details all these tests and more. And if you want a link to that particular protocol, you can find it in the description below. So the first test I'd like to take you through is the single leg hop test, also known as the hop for distance test. Quite simply here, we're going to ask our patient to jump from one leg and then land on the same leg, and we're going to measure the distance over which they complete that hop. Now, the first time your patient does this, you definitely want to give them a couple of attempts to make sure that they feel comfortable with the test. As you can imagine, if you've never done it before and you've had an ACL reconstruction, jumping and landing on the same leg can be quite scary. So don't be surprised if your patient wants to practice this 2 or 3 times before they do the test for real. So quite simply here, we ask the patient to stand on one leg just with their feet in front of a particular marker. They're allowed to use their arms for leverage, and we're going to ask them to hop from one point to another point. They have to control the landing. That's really crucial. We're not going to accept the hop if they either stutter or they lose their balance, or if their foot goes land, 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 for example. So we would actually start this test on the non-operated leg because it gives us a baseline measurement to compare the operated leg to. So for example, if we jumped 150 centimeters on the non-operated leg, 150 centimeters would measure 100%. So then we can jump on the operated leg and see if they achieve 60% of that, or 70% of that, or 80% of that. And actually, to make sure that our patient is ready to return to sport, we want to achieve 95% of what is jumped on the non-operated leg. So the second test is the triple hop test. This is very similar to the single leg hop test, but instead of just going jump, land, we're going to do jump, 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 land, all on the same leg. So again, your patient is allowed to practice a couple of times before they do the test measurement, and they're also allowed to use their arms. But once again, we have to make sure that they nail and control that landing for it to be a pure measurement. We're not going to accept it if they lose their balance, or when they come to do the final landing that they have to do a couple of steps afterwards in order to gain their balance. So here, the measurement is the total distance covered from the start line to the landing point on the third jump. We would naturally measure the non-operated leg first to gain our 100% baseline measurement, and we would then compare that on the operated leg. And once again, in order to meet the markers to return to sport, we're aiming for 95% of our baseline measurement. So the third test is the triple hop crossover test. This is great because it's starting to challenge that side-to-side lateral stability for our patient's injured leg. So here we're going to ask them to once again do 3 individual hops. However, we mark a line down the middle and ask our patient to cross either side of that line when they're completing their 3 different hops. The key here is that we start with the first movement laterally. So if we're standing on the right leg, we're going to move to the right first. If we're standing on the left leg, we're going to move to the left first. And the idea being that we go lateral, medial, lateral, and we have to land that third lateral jump to make sure that we complete the test accurately. Same rules apply. You can practice, you can use your arms, you have to nail the landing, and we're going to measure once again the total distance covered by the 3 individual hops. We start with a non-operated leg, we then get a baseline measurement to compare to the operated leg, and you guessed it, we're aiming for 95% of what the non-operated leg can do. Next, we have the Cytop test, and once again, this is a great measurement for that lateral stability testing for our patient. So here we start by placing 2 markers 40 centimeters apart on the floor, and we ask our patient to stand on one leg, whichever leg is being tested, and they're then going to hop either side of the line for approximately 30 seconds. We're going to measure how many hops they complete from one side to the other across that 30-second period. So key things here. We're only going to count the number of successful jumps, and a successful jump means that they are able to clear the marker to which they're moving towards. So for example, if they touch the line or they step within inside the line, it doesn't count as a successful jump. Once again, we would normally test the non-operated leg first to give us our baseline measurement, and then once again, you guessed it, we're aiming for 95% of that on our operated leg within that 30-second period. Next, we have the single leg rise test, also known as the single rise to fatigue test. Here we're going to ask our patient to sit on a surface where their knees and hips are at 90 degrees of flexion, and we're going to ask our patient to stand up, sit down repeatedly on that one leg without the other leg touching the floor. The idea here is that you're looking at 2 seconds on the way up and 2 seconds on the way down, and your patient is going to repeat single leg rising until they can no longer do any more, or until they lose their balance and they feel like they have to stop the test. So when the patient stands up and returns to sitting, that's 1 repetition. We're going to count the number of repetitions that the patient can do, once again, until they fatigue or that they lose their balance and have to stop the test. We're going to start on the non-operated leg. We're going to get a baseline measurement, which represents 100%, and then we're aiming for 95% of that on the operated leg. So the final test I want to take you through is the STAR Excursion balance test. This is where we're testing the patient's balance and their ability to stand on one leg whilst touching their other leg on certain points around them. So to do this test, we're going to use markers, normally tape, on the floor, whereby the pieces of tape intersect in a plus and then a cross sign so that each strand of tape is 45 degrees apart from the other. So from here, the patient stands on one leg in the middle of the star, and the leg they're standing on is going to be their testing leg. They're then going to reach their other leg out to touch each of the points, or as far as they can, along the pieces of tape on all of the points around the circle, and we're going to measure the distance to which they reach on each individual strand. So key points for the test, starting with the order. So if your patient is standing on their right leg, then their left leg is going to reach out to the 12 o'clock position first, and then their left leg is going to move in an anti-clockwise direction round all the different points before they get back to the 12 o'clock position. Conversely, if the patient is standing on their left leg, then the right leg will reach towards 12 o'clock first before moving in a clockwise direction round each of the points before returning back to the 12 o'clock position. So in order to meet a successful measurement, your patient is allowed to reach out and lightly touch as far away on that particular strand as they can with their toes. However, if you find that your patient steps and puts more weight on that particular point, or if they find that they lose their balance by stepping and then having to put their foot down again on a different point in order to correct themselves, this would constitute a negative measurement. So how do we measure this? Well, first of all, we ask the patient to complete 3 cycles on their non-operated leg, and we're going to measure the average distance that they reached to on each individual strand. We then get them to do the same thing on the operated leg. We're going to get them to do it 3 times, and we're going to measure the average distance that they reached on each individual strand. So to create a score for this, we simply measure the average distance on each individual strand on the non-operated leg, and then we compare that to the average distance on each individual strand on the operated leg. And for each strand, once again, you're looking for 95% of what the non-operated leg can do. And of course, if there is a particular strand that doesn't meet that, you know exactly the direction that your patient needs to practice to be able to meet that marker. So final thoughts from me. These tests are brilliant at telling you if your patient is physically ready, but they're also really good at telling you, as well as telling your patient, if they are psychologically ready. For example, what if they don't feel capable of hopping on one leg? What if they don't feel like they can control the landing from one side to the other? That tells you a story in itself, and perhaps they need to practice those particular tests in order to make sure that they can gain confidence in order to return to sport. Another great idea is making sure that you complete these tests when your patient feels healthy, but also when they feel fatigued. What about when they've just done a half an hour gym session? That's also a really great time to test them, because when we're in fatigue, we want to make sure that our leg can still cope with the demands placed upon it in that sporting environment. So if you've enjoyed this video, make sure to smash that like button, subscribe to the channel for updates, and also check out our website clinicalphysio.com. We've got loads of brilliant resources on there, including a full ACL injuries webinar. And if you want, you can find a link for that in the description below. Otherwise, I'm Khalid. Thank you so much for watching. See you soon here on Clinical Physio.